Hi everybody, thanks for tuning into Module 8 on Structural Abnormalities, part of our EKG Fundamentals series. Learning objectives for this module, you're going to be able to describe the EKG features associated with left ventricular hypertrophy and right ventricular hypertrophy, and also be able to recognize how atrial enlargement may be determined in EKGs. Before we get started, I want to remind you that each of these structural abnormalities have unique criteria that are used to determine whether they are present in EKGs. What I'm going to highlight are either the most common criteria or just common features you would expect to see in EKGs containing these abnormalities. Once you become more comfortable recognizing such EKG strips, I definitely do encourage that you go ahead and look into some of these criteria just to further your learning. Let's start with LVH, or left ventricular hypertrophy. As the name suggests, this is the hypertrophy of the left ventricle. In such a scenario, you generally see changes to the precordial leads, since those are the leads that have the best view of the left ventricle. The most common criteria used to determine if LVH is present is called the line criteria, in which you take the S wave of V1 and add it to the amplitude of the R wave in either V5 or V6. You want to add these two amplitudes, and if it's greater than 7 big boxes or 35 millimeters, which are both the same thing, then you have LVH. I'll repeat that again. You're going to take the height of the S wave in V1 and add it to the height of the R wave in either V5 or V6. If it adds up to 7 or greater big boxes or 35 millimeters, then LVH is present. Keep in mind there are several other criteria that can be used to determine left ventricular hypertrophy. Here is an example of left ventricular hypertrophy that meets the line criteria. As you can see, here is the S wave in V1 and the R wave in V6. The S wave extends down about 5.5 big boxes, and the R wave in V6 extends up about 4 big boxes. This adds up to about 9.5, which is greater than 7, therefore meeting LVH criteria. Here is another example of LVH. As you can see, the S wave in V1 extends down about 4 big boxes, and the R wave in V6 extends up about 5 big boxes. Keep in mind we can also look at the R wave in V5, which extends up about 5 to 6 big boxes. Either way, we meet the threshold for LVH. Let's talk about right ventricular hypertrophy now. To meet this criteria, you need two things. Number one, you need a right axis deviation, and we talked about how to determine that in our axis video. Number two, you want to look at V1 and make sure that the R to S ratio is greater than 1, and then look at either V5 or V6 again, and make sure that the R to S ratio is less than 1. This is a little bit confusing, but the easiest way to understand this is the R wave in V1 and the S wave in V5 or V6 point away from each other. And we'll look at an example of this in the following slide. So this is a great example of right ventricular hypertrophy. As you can see, the QRS in lead 1 is more negative, while leads 2 and AVF are both positive, indicating right axis deviation. Now let's look at V1. You can tell right away that the R wave is much larger than the S wave, meaning that the R to S ratio is greater than 1. If you look at lead 6, you could tell that the S wave is larger than the R wave, meaning the R to S ratio is less than 1. In other words, the QRS in V1 and the QRS in V6 are pointing in opposite directions. Since we have the finding of right axis deviation and these R and S waves pointing in opposite directions, we can call this a right ventricular hypertrophy. Alright, let's talk about atrial enlargement now. The criteria for atrial enlargement lack sensitivity and specificity for both the left and right atria, but it is important to know the classic appearance in EKGs for both left atrial enlargement and right atrial enlargement. In both cases, you want to look at the P wave. As you already know, the P wave represents atrial depolarization. The very initial portion of the P wave is more representative of right atrial depolarization, while the later portion of the P wave is more representative of left atrial depolarization. In the case of right atrial enlargement, we expect to see peakening of the P waves, more so the initial portion of the P wave. So it would look more like this, with the QRS complex following. In the case of left atrial enlargement, we would actually see more of a notching of the P wave, so something that looks a little bit like this, followed by the QRS complex. Just to review, the right atrial enlargement, we see more of a peakening, while in the left, we see more of a notching. Right atrial enlargement is also called P pulmonale, as it's typically seen in pulmonary conditions such as pulmonary hypertension, while left atrial enlargement is classically called P mitrale, as it's often seen in diseases such as mitral stenosis. Keep in mind that in both conditions, it's lead 2 which we are looking at. This is a classic example of P pulmonale, or right atrial enlargement. As you can see, there is definitely peakening of the P wave in lead 2, but also in several other leads in this specific EKG. Here's another example of right atrial enlargement with the peakening of the P wave in lead 2. I also want to point out that there are changes to V1 that also occur during atrial enlargement. In a normal V1, you typically can see a biphasic P wave. In the case of right atrial enlargement, that initial portion of the P wave becomes a little bit more peaked with this sort of appearance. In the case of left atrial enlargement, as we'll see in following slides, it's the later portion that dips down a little bit more than it does in normal. To summarize, you want to look at leads 2 and V1 to really determine if atrial enlargement are present, and even then, these findings aren't always very sensitive. Here is an example of left atrial enlargement, or P mitrale. As you can see in lead 2, the P waves are notched right in the middle. You'll notice in V1, the downward inflection of the biphasic P wave is more prominent than the upward positive inflection. Additionally, we see notching in several other leads as well. And that's about it for this video. Good job for hanging in there. The takeaway? We know that several EKG findings can indicate structural abnormalities of the heart, such as left ventricular hypertrophy, right ventricular hypertrophy, and atrial enlargement. Keep in mind that there are many different criteria for each of these findings. We went over the most basic EKG characteristics for each of these conditions. Finally, we discussed the findings of atrial enlargement aren't always sensitive and can be tough to interpret in many cases. That's about it for today. I'll see you on the next one.